first time I took therapy, which was when I was on my own, and I told my mom about it, and she whispered, "Don't tell anybody."
Wow.
And recently she was like, "Oh, do you think I can, therapy will help me?" I was like, "Oh, no, beyond repair now."
Meet Kanu, a visionary entrepreneur tackling one of the biggest crises of our time, youth mental health. She's on a mission to make specialised care accessible, affordable and immediate.
My brother had developed addiction, and I recently lost a cousin to that, and he was a doctor. Doctors know how to get access to drugs. Simple. And I'd seen firsthand how that impacts the whole family. For me, the hope is that every family that needs access to specialist care should have it on the day. There's been a 22% increase in teenage hospitalization. What I realized was that it has the highest mortality rate, but the least research investment. This is a problem I want to solve, young people's mental health.
This is not just a UK issue, this is a worldwide issue. Yeah, I really strongly believe we're sitting in a mental health epidemic.
There's a huge stigma, there's a lot of shaming, naming to it. That is the problem. The solution should meet people where they are. And there are so many young people who are not open to therapy. So this kind of an approach brilliantly works.
What do you think is the real solution? Cost and scalability. How do we solve this problem?
And I think that is where my bet is on.
Kanu, you've been living in different countries before the UK.
Yeah.
Why are you in the UK?
Why in the UK? First reason was I was living in Singapore during COVID and it felt really restrictive. So I wanted to step out. The second reason was that I wanted to build in young people's mental health. And I came across this venture builder, which I was like, oh, wow. It was LinkedIn Algo matching us. And I thought, perfect. It's serendipity. And I am off. And and I studied in the UK. So it was an easy, like London, it was an easy choice to come back.
So you studied in the UK and then you went back to Singapore.
Yeah.
So why don't you study in Singapore? I mean, why did you come to the UK to study?
I always had this thing of studying at LSE. So it was always the thing. And I don't think I could have survived the whole Asian tough love education system. Yeah. So I really like the fact that you can debate with your professors. And I always envision, because even Indian education is really good, but it is very top down.
Yep.
So I always dreamt that one day I'll study in a university where I can have a debate with my professor, then go and grab a beer later, and then actually continue the debate. And which is exactly what LSA was. So
your expectations match the reality.
Yeah.
Perfect.
Yeah.
Perfect. So a little bit of backstory. So you're born and raised in Singapore?
India.
Or were you in India? Okay.
So born and raised in India, in Agra, and then lived there for 18 years of my life, moved to Delhi for my education, then moved around. Different locations as part of my work. I started work with international SOS, then moved for 1 year to Paris, for 1 year to US, for 1 year to Thailand, Bangkok particularly, and London with them, Aberdeen with them, Scotland. So that was part of journey. And until then, the company was like, okay, you are anyway not living in India. So how about you join the head office in Singapore? So then I joined Singapore. And that was 10 years then after that. And in between, I actually took a pause with my employment, did LSE, went back to Singapore, then decided back to London. And now looks like London will be home for the next decade.
Oh, wow.
Yeah.
Okay. So, I mean, it's interesting because you've been to many, many, many different places. I think going on a holiday in a city is different versus living in the city. It's a night and day experience. So tell me something about that experience, because now ultimately you've landed in the UK. LSE was maybe one of the catalysts, but now you're saying, okay, so at least for the next decade, you're going to be here. So you are maybe seeing something better here versus all the other experiences that you have. Why have you now landed in the UK?
I think a lot of my relocations were with my employment, right? So which kind of becomes easy because I always had that thought, the company is going to sort it out all. I just need to move, right? Why now? Because I think I came at a place where I was like, okay, I am nowhere anymore. In the beginning, I loved that feeling because India was very all-consuming, where I lived 20 years in. I mean, my family still lives in the house that they generationally was bought 80 years ago.
Wow.
Right? So from that kind of an upbringing, I was like, okay, I am out of this. I was literally clocking days to get out. And now I'm like, okay, I did go to the other side of the pendulum quite a bit. And I have friends, there was a big realization that there would never be one place where I'll have all my loved ones now, ever. That's gone. thanks to the life I lived for the last 15, 18 years, which is great, but not great as well. It has its pros and cons, right? So when that started sinking in, I like London for many different reasons. One, that it's very inclusive. I love that. Like, it is just a very different feeling. Like, every dinner table feels like international, sort of UN meeting kind of a feeling, and I love that. Singapore was quite like that as well.
Yeah.
So that is where the love for it came. I love the fact that human rights are extremely important. India is a democracy, but when you don't have money, you don't have the right in India.
Yeah.
And that is something extremely disturbing when you live there. I think we don't realize when we live in a country like that, because I grew up with a perpetual guilt. Like, you eat something and then you see somebody who is most likely, has not had food for a couple of days.
Yeah.
So that guilt and that human psychology, that like human experience that I lived with for 20 years, when I'm like, okay, at least people have basic, education. Every child has education, access to education. Every individual has access to healthcare. And, on their worst days, the government is going to give them benefits. So it's not like, they're going to die of hunger. For me, those kind of things, like UK and London, for that works. I know there are issues and there's work to be done. But like between Singapore and India, my two key countries that I lived in, I could not find that. Like, Singapore is very different, very privatized, very, That is also it's so controlled that you then don't have the right.
Yeah.
Right? So for me, it's a democracy, so I should be, but yeah, quote unquote, right?
Politically correct.
Yeah, it's a democracy, but, there you go.
It's interesting because you spoke about India, and I can relate because I'm ethnically Indian, but I grew up in Dubai. But do you not get like desensitized around, because you see that every single day, so it just becomes your normal? And then, because it's interesting that you were still thinking about it. Like, was it playing on your mind? Like it was always on your mind?
For me as an individual.
Okay.
I remember you're right. When I'm in there, it's not like I'm on a day in and out making choices. No, I was not that but the feeling, like, I don't know how you ignore that side of humanity. Like, when you see like 2-year-old kids running on a street which is 50 degrees hot and they don't even have footwear.
Yeah, it's quite sad.
And they're like, how do you not feel that? How would that feel? And I actually realized how shitty I felt after moving to Singapore. Because I stopped feeling that shittiness. I was like, oh, there's some change happening in me. Though I was getting bored of Singapore because everything was like clinical and the brain is never satisfied. But my biggest realization came of how much it impacted me when I was out of India. And that guilt, like, everything runs with guilt first. That became my default way of working. Like, I remember the first time Pizza Hut came to India and we'd ordered pizza, and my mom had whispered in my ears to say that don't pay in front of the helper. That's her monthly salary.
Oh,
and
wow.
I felt like so bad.
Wow.
That one, like, pizza, and because there is no basic salary rights, they're like, those kinds. And it is just very overwhelmingly disturbing as a human being. And you're right, you don't realize that when you're in that moment. But I remember these, like, conversations very deeply. And I must have been, 11 or 12 then. So I still have exact memory of, like, how I felt. And I don't know if I even finished the pizza or I, like, felt good about it and bothered not to order it again.
Yeah, I mean, like you said, as a human being, like, how can you not think about it like that? And how can you not feel bad about it? I think it's important as well, to have that core humanity against, towards other people.
Doesn't mean I don't waste money.
No, of course. Of course we do. But I think that being like something top of your mind rather than an afterthought, I think that's super important.
Yeah.
Only then are we able to, and it's interesting as well, when you come out of that situation, you kind of start realizing that more. And then perhaps when you go back, then you see it even more. Then it just becomes that much more evident. Yeah.
It still gives me goosebumps. Like, even right now, like, it still has that feeling that's very chilling to know that people make choice between food or medicine, food or education on a daily basis. It's extremely intense.
Yeah, I think it's sad to see the disparity between rich and poor.
Yeah, and that is another thing.
Too much.
Like, as much as the Ambani wedding was going all over, to each his own.
Yeah.
But
I know. I mean, you know that example that you gave, like a little child running running bare feet on the street and in the heat. Like, but I've visited India and I've seen that. I've witnessed that. And you're sitting in a
your
nice
air-conditioned
car, air
and, like,
conditioned,
honking
whatever, and they're like on your windows, and you're just like, it's just two different worlds within the same space. Like it's just like your mind can't fathom that. Like it's just that's quite
How
sad.
do you make peace with that? And
No.
I mean, I can go anyway. It's a topic that I can digress into very deeply, because even during COVID, there's no human right. Like, people just disowned their staff. Like, come on, you earn like 100x more through the work that they've done. Can you not support people for 6 months? Basic salary? People just disown their staff because it's so easy to get staff again.
Yeah.
And there's no right. Like, you can just tell people, sorry, it's COVID. No clients are coming in, like restaurants. Sorry, guys. And these people live on daily, like literally hand to mouth.
Yeah.
If at all that. What would they do? So, yeah, it's just another side of...
Yeah. I mean, for me, that's one of the things, right, in the UK. So since I've moved, and obviously I've not seen that reality, but obviously I know that reality. And for me, coming here, I'm just ever so grateful. I'm just like, oh my God, like everything here is just like a bonus and a bonus and a bonus.
People
Not only from a business
taxes,
perspective,
people
everything.
can complain about everything, and I do complain about it. Singapore was very low tax.
Yeah,
so
yeah.
I took the benefits of that world as well.
Yeah.
So, but I would rather pay the tax and
100%.
have everybody get universal.
100%. I've always said that. Like, okay, take the money,
Yeah.
whatever it is. In fact, I mean, now the country's given me so much. Okay, how can I pay it forward?
Exactly.
Like, what can I do?
Exactly.
And I think it's one of those, right? So it's when you're in a system, perhaps you don't see, and the grass is always green on the other side anyway. And it's important maybe for people not just to go on holidays, but maybe to live in different countries and understand the actual system, and then compare.
Yeah.
Because I think it's interesting, and not from a biased perspective. I think it's just reality. Because, like, for example, my nephew is growing up here now, and he will have a different reality than I do, and maybe a different level of appreciation than I do, simply because I did not have, and now I have, and I'm like, oh my God, this is crazy. But if I always had, then maybe that level of appreciation, and I'm not generalizing, I hope people don't take this the wrong way. It's just my perspective.
Yeah.
And what I see and hear on the daily from people who do not have my perspective, so there is a complaint, yes, and I think in a good democracy, I think people should also have the right to complain. Yeah. Because people should demand better. I think that's super important. But I think maybe there's a slight, maybe there's a fine line between complaining and being a part of the solution. I think that's really important. Okay, there's a problem. What is the solution? How can I be a part of the solution? Because this is my place, and I just want better for myself and the people around me.
And what are you doing about it is, the question. It's the same that goes about whether it's gender equality, whether it's D&I, right? When, like, what do you do about it?
Yeah.
Instead of complaining, and then like
Correct.
it's perspective, right?
Correct.
Holding that little, like when I moved to Singapore for the first time, I was like, oh wow, people were complaining, like people would complain government should do this and government should. I'm like, you shouldn't need to live in India to see, because in India, like it's not like Singapore, we pay less than 10% tax. We used to pay, like for my salary, I was paying over 30% tax, and still the people don't have basic rights, right? So I'm like, you've not seen the real world, like.
Yeah. That reality. You haven't seen that reality.
It can get worse.
Yeah. And by the way, there are places worse than India.
Yeah, exactly.
So, I mean, India still is wow compared to...
There's people can,
Yeah.
And with the current economic, growth, India, that way, I love it because there's hope for everybody.
Correct. Yeah.
You can be anyone very quickly.
Yeah. London in particular is quite interesting as well, because I also looked at different countries before, so I'm like, okay, I'm in Dubai, where can I move? And it was, okay, London, America, mostly London, America.
Yeah.
So UK and the US. But London, I think, like you rightly said, it's a very unique melting pot as well. So Dubai is a big melting pot, as you know, but somehow I think the diversity here is so much more intense compared to London. And it is like, I've never heard that statement, by the way, but it is like sitting in a round table at the UN summit or something, because you can really find people from all walks of life, cultural backgrounds, religious backgrounds, and so on. But it's also, I think, one of the true strengths of London, or any city which embraces, diversity and inclusion. I think that's
the first time I relocated to London was with my job, actually, not even before LSE. And I was actually trying it out. I didn't relocate then because the taxes didn't make sense between Singapore and London. My employer was like, taxes is an employee's problem. I said, not anymore when you start charging me so much more. But anyway, I remember my first impression was I relocated, I think 6 or 7 times then, like between India and cities and internationally. That just the first evening, I had my colleagues like, oh, there's a movie night, you want to come? And I had never had that experience. It always takes a while to build life and have friends. And London is an inclusive city. Firstly, people stay here long. So I don't know if that's the case in Dubai, but in Singapore, everybody's like there for 3 to 4 years. So, every 3 to 4 years, you have a different life because your set of friends have changed. So the continuity of people who have actually, you've shared your life's experiences with would change. And I think that for me is the biggest memory of UK to say. And even when I moved to Aberdeen, I just loved Scotland. My company thought they sort of, they did me so many favors for taking up that job because I agreed to move to Aberdeen. They thought she will never agree and all that because, it's not a city. I just loved it. I was like, dude, why? I was like, Scottish people are so...
Oh, they're beautiful people, yeah.
They are so lovely.
Yeah.
Right? And I was like, and my company felt that they've not, they have to actually compensate for it. So my next thing was I got a promotion because I actually agreed to go to Aberdeen. I was like, sure, why not? But I loved it, every bit of it. People were lovely. I remember people baking stuff and bringing to office, right? And just I was baking last night. Here's it for everybody. So yeah, there's that side of community that I think, I really like about London and UK in general.
I think, and I don't know if I'm going to be politically correct by saying this, but I think, so I felt that a lot in this city. I feel like, wow, everyone is so loving, so caring, so respectful. And, when you're walking down the street, people just say hi to you, people smile. As it's such a refreshing experience. I was like, oh, wow, this is so
being
amazing.
nice to people is something.
It's so nice.
Yeah.
It's so nice to feel nice from other people. Everything is just, there's just so much love. Yeah. But and then I was like, okay, but why? Why is this the case? Now, if you flip the script, and if you look at India, for example, when you don't have food to eat, your number one priority is to fill your stomach.
Yeah.
Your priority is not going to be now to be nice to people and hold the door. And because we talk about etiquettes and a lot of things also come into play, right? We're like, oh my God, people in some countries don't have manners.
Luxury.
Yeah, it's a thing of
sense.
luxury. Exactly. So that sense only comes when,
when you've had the time and the patience to.
Exactly. Then you can level up as an individual as well. So I think really, and I think it's very important for us to think about that as well. I think we're in a very fortunate city, country, place that we have all those luxuries.
Exactly.
Your basic necessities, you spoke about healthcare and, your electricity doesn't go off every single day. And, there's too many things which we take for granted.
Yeah.
You have all that covered.
Yeah.
And now you have the ability to do anything and become anything.
Yeah.
That's just fantastic.
Clean water, there's some things that we don't even think about.
No, yeah.
Yeah, and I that's why I don't I don't feel upset about being in India in that sense, because I think I then look at people that despite the adversities, they are so positive.
Yes, that's also true.
They're happy.
That's also true.
Look at people playing and, still even if it's dirty rainwater, the kids are just jumping. And you look at that side of humanity as well.
Yeah.
Right? The other day I was telling somebody, I just got back from India. I always spend my end of the year in India at home and family and friends. And I think, as twisted with, mental health and everything that a family might have been, one of the privilege we don't talk about is a loving family.
Oh, yeah.
I think that fundamentally, you might not have money,
Correct.
you might not have education, you might not have anything, but if you've had a set of parents specifically, where you've had that connection and love, nothing fundamentally beats that privilege. And not everybody gets that privilege. Sometimes because they're not with their parents, sometimes because the parents are not equipped in that way, and I think we don't that is a different level of privilege.
It's interesting you say that, and it's a fact, by the way. Yeah. So if you look at the communities in India and countries like India, for example, I might be generalizing now, but do you think the reason there's a lot more stigma around mental health in that part of the world, India, Asia specifically, is also because maybe the need isn't that much, because you have a community, and that community, you have that shared experience and you don't have that much isolation?
So loneliness, okay, so short on, no, I think the need is equally, in fact, more there.
Okay.
Lower socioeconomic, more stress, right? Gender equality rights. Women have a lot of like trauma stuff that they go through. So I think there are other issues, right? It might not be the issue of loneliness as much. And there might be a stat that might prove me totally wrong right now, right? Indian people might be equally. But if I look at my family and my individual, my extended family, lonely. In fact, if anything, we all want space. Like, if anything, we just want
It's the opposite problem.
Yeah, like
Enough.
Yeah, I had to tell my family every time, like almost every day, time out. Like everybody just, no more of sitting together and watching TV together.
I feel your pain. I feel your pain.
Yeah. And like, if I'm sitting in my room, I'm like, why are you sitting alone? I'm like, because I want alone. So yeah, I mean, I'm sure some people, not some, but there's a lot of people who also feel lonely. But I think issues are different. And then India, like, you just can't generalize with a 1.4 billion population.
Yeah, correct.
With, like, you'll go to Mumbai and Delhi, they're like London. People are living very isolated, like, in their home, like nuclear families, single child is a big thing. It's not a rule like China, but, like my nephew is the only child that my brother has. So it's just like, and then I look at these kids and I'm like, oh, they're going to be fucking lonely.
Yeah.
Right?
Yeah.
So yes, the issues are different, but they equally exist. Mental health, people don't talk about awareness, right? Like I was talking to my nieces who are teenagers and coming to university, and they were like, yeah, every second child self-harms. I was like, oh, and what do you guys do about it? Like the parents are not ready to pay for therapy because they think it's bullshit. They just think, whack the child and get it sorted. It's very Indian in that sense. So that awareness, education. So when I was actually building the solution, when I thought I'd start Speak, at that time, the Speak was not the name in my mind, but when I thought of starting this, I still want to go take it back to India at some point, right? But then the problem with the Indian market was it's more about education awareness. It's opened up. Therapy is opening up, but then, it's still a way to go. It's still a way to go about understanding around neurodiversity, coming out, like in the UK, I think it was 30 years ago, the whole, like it's still there. People, talk about coming out and there's more acceptance, but in India, it's sort of the generation.
Right.
So it's becoming a common thing, and I'm sure it's always been there. People were not open to it, right? But that means that there's a huge transformation, generational change that's happening. So those kind of things will bring up newer issues in time because they're like, people don't want, like your society or your family doesn't want to accept. So
Correct.
So the issues are different, but they exist. It's more about acceptance yet.
Yeah, I can relate. I mean, definitely there's a lot of stigma around mental health across the globe.
Yeah.
But there's different levels.
Yeah.
So when you look at the UK, US, the stigma obviously is a little bit less than the Middle East or the Asian world. And that is one of the reasons that I also moved to the UK. So Speak.
Yeah.
Let's speak about Speak.
Yes, let's speak.
Where did it start? Why did it start?
I mean, Speak comes from a place of lived experience. My brother had developed addiction when we were young people, and like when we were young. I'm getting used to calling this young people because I just write it on brochures and stuff all the time.
You're still young. You're still young.
Yeah. No, it's not like we were young. Like it is a young people, right? I know. So the thing is that back in the day in India, it would be basically bad behavior. Like stop it.
Okay.
Right? And you hide it because you don't want anybody to know.
Yes.
Simply. And you keep hiding it. And I recently lost a cousin to that. And like he was a doctor. And, you can't hide. Like you can't not have, like doctors know how to get access to drugs. Simple. So if you're hiding it and not actually accepting it and taking the person for treatment, you're just making it worse for the person. So it was considered a bad behavior thing, and I'd seen firsthand how that impacts the whole family. To the point, like with all this exposure to mental health issues, the first time I took therapy, which was when I was on my own, and I told my mom about it, and she whispered, "Don't tell anybody."
Wow.
And now recently she was like, "Oh, do you think I can therapy will help me?" I was like, "Oh, no, beyond repaired now." It's like nothing will change anything here. I said, "It's fine now. You just relax." But it's like.
But sorry to interrupt you. Before you continue that, I think we're laughing, but behind every joke there's a little bit of truth. I strongly believe no therapist on this planet can save you. Only you can save you. Like you need to put in the work. That is so important.
No, but even for
You
that,
know?
I was like, she's turning 70 next year. I was like, Mom,
Take it easy.
take it easy.
Take it
now.
easy.
No, it's fine.
Why are you stressing yourself now?
Now it's for us. We've
Yeah.
dealt with it. Right. So no, but I think that acceptance is because there's no societal acceptance to it. There's a huge stigma. There's a lot of shaming, naming to it. That is the problem, and hence that would also lead to more issues. Right, different kind of issues because you're not going to seek treatment. You're not going to seek the right treatment. Yeah, my brother is fine now, but yeah, it is. It's still like it's a journey.
Yeah.
Yeah.
Sorry to hear that, by the way. Yeah. And also, I mean, it's also quite eye-opening that, he was also a doctor. So, I mean, you think, okay, so he's a doctor, he obviously knows. And so, I mean, that is why it's very important for us not to judge.
Yeah.
And really, like it is a problem.
That actually
How
made it
can we-
worse. In India, the number of doctors that are doctors have access to drugs.
Yeah, yeah.
He doesn't need he
Correct.
needs to write a prescription for himself or get it written by somebody. And it's very stressful. The education of medical education is
Sure.
extremely stressful in India. It's a lot.
Even the work itself is very stressful.
Exactly.
Yeah.
Yeah. So, yeah. And then it leads to all the other issues. So the fact that people which is actually something that's happening even in the UK at this point, because it's not like it's not acceptance, but if you have a 2-year wait list, what will happen? When a young person is self-harming, which means there's definitely distress, that would lead to comorbidities and mental health issues if not addressed at the right time. So it's not because there's no acceptance. In India, we have acceptance issue. Here we are accepting, but we don't have access to care. And we are not making care accessible and affordable, right? So then you're going to lead to the same place of crisis. And that's why there's been a 22% increase in teenage hospitalization in the last 3 years in the UK. Because they're waiting on the wait list. Like literally every day I talk to parents. By the way, 99% moms, I think somehow it's not a father's problem. Yeah, somehow, like when it comes to teen, I feel like saying it. And a lot of moms say this to me, oh, my husband is not comfortable talking about self-harm. I'm like, oh, how sweet. So,
Wow.
like, I mean, I don't say it to them, but I'm like, oh. But anyway, that's a separate issue. But, the moms have all the heavy lifting to do. And she's like, oh, you know what? It's been 13 months of waiting on a CAMS wait list. And they've told me I'm top of the list. So maybe I'll get it. I'm like,
Wow.
Yeah.
So, I mean, we spoke about this just before. I mean, yeah, I really strongly believe we're sitting in a mental health epidemic.
Yeah.
And if you apply an element of addiction to that, and then the younger generation,
Yeah.
where the minds are also not developed yet,
Yeah.
I mean, that's just a recipe for disaster. you know?
Exactly. We don't know
And
the
sadly-
generational impact that it will have.
Correct,
on it.
correct.
And everything, right? Like you said, it's an economic impact. If you're not concerned about people,
Yep.
employment would be a concern. Like, how would they go and work?
Yeah, that's quite sad.
Yeah.
What's Speak? Okay, so talk me through Speak now. So
Yeah.
what does Speak focus on? What does it do? Is it doing exactly what you thought it's going to do, or you started off with a different idea?
So, very candidly, I did not start with a solution. I actually didn't know, because I always thought that I'm not somebody who can come up with a solution, which I still believe, right? Like, I know I want to solve this problem, right? Where it will lead and what it will lead to is time will tell.
Sure.
Right? I did have a starting point to say, okay, quickly what we can do so that we get to know our users better or we get to learn is something, let's start with a service that is better than what they currently get, better, faster, cheaper than what they currently get. Can we do that? And that's an incremental first step, which I believe, I've spent 15 years building healthcare, and I give a lot of credit to working for one of the best companies, International SOS, to say that I learned from the best. I saw how good healthcare services are done. By the time I left, I think their annual revenue was somewhere around 2 billion.
Oh, amazing.
Privately run services
Amazing.
business, no tech, no SaaS, privately owned, like some PE money. There are some real case studies here, and we're talking about a 12,000 workforce. Everything that the people would say don't talk about,
Yeah.
they do that, and they're
Amazing.
successful. Right? 80% of the Fortune 1000 companies are their clients, 99% renewal rate.
Wow.
Yeah, and they're expensive. Boy, are they expensive? They are expensive. They're not cheap. But when your employee will need healthcare, and they give the best quality service, right? So that's the deal, right? So obviously, in the current economic market, I'm sure there are things changing. So having worked with an organization like that, I had seen the power of building like operational excellence, process innovation, right? And that is what I brought to the table to say, this is a problem I want to solve, young people's mental health. Within that, let me just dissect and understand. I wanted to work in addiction particularly, but then I realized that self-harm, interestingly, self-harm has similar neural pathway in the sense of like it is an addictive behavior, unhealthy coping mechanism, right? And 1 in 5 teenager today self-harms, which is, I think, a very like sort of a disturbing number to not address. Unfortunately, it used to impact lower income families, marginalized communities like LGBTQ plus young women more than young boys. And what I realized was that it has the highest mortality rate, but the least research investment.
Wow.
And I was like,
That's
how is this?
interesting.
Of course, because
Yeah.
it impacts marginalized communities. So, you
Got it.
your investments happen.
Yeah.
Right? And that I found everything about it like to say that, okay, this is a fucking difficult problem.
Yeah.
So, when you, if it's simple, it doesn't excite me.
You need a challenge.
That's therapy room discussion.
You need a challenge, yeah.
Exactly.
You need different flavors.
Yeah.
Because vanilla is too boring.
Yeah, it was like, I never liked vanilla. But there you go.
Same
Yeah. So that's when I was like, okay, addiction is, and it was about having a starting point. It was having a starting point, which I think we got into the right starting point. It's not being addressed globally. So that was another reason. It also has that element that it's a symptom, not a diagnosis. And I like that about mental health, because what is addiction? Like I'm addicted, I have addiction diagnosis. What does it mean? I have an eating disorder diagnosis. What does it mean? Diagnosis is like the underlying problem, which nobody is actually diagnosing. So everything is a symptom. If I have disordered eating, this means there's something else going on inside me, right? And so that trans-diagnostic approach is something that I also liked about mental health. And that's why starting with self-harm, we had a starting point of saying, okay, we'll start with, because in healthcare, it's a sensitive area. It's an area where you need to keep in mind, clinically, what you can and cannot do in the beginning. So we started with a very simple proposition that parents have no idea of how to deal with it. Let's start working with them, providing them psychoeducation. And that's slightly low clinical risk by the time we actually raise investment and get the money to put the clinical rigor in place, which we've done now. And we've launched our family program, intervention, which includes the child and everybody to provide treatment. So the first 1.5 years was about working with the parents, which was also a brilliant way of us getting into the understanding of what is happening in these families. Are there patterns, themes that we can figure out where we can actually provide interventions that work? So yeah, that is where been the journey with Speak. Interestingly, I think in healthcare, we can say that in a lot of areas, when it comes to science, there is a lot of research. Dialectical behavior therapy is a gold standard for self-harm reduction, right? In the UK, we only have 700 trained DBT therapists. And we are talking about, including adults and children, right? Like not everybody. So let's assume 50% of them, if at all, can work with young people because they have experience. So we are talking about 350 for such a big pool. So how do you make those specialist services, which are today sitting in tier 4 in NHS, which means you'll be waiting for 2 years to access them, to the front end, instead of giving crappy stopgap solutions like, you can do 4 sessions of therapy. What does that mean? Sure, it's better than nothing, right? But if we know something works, why can't we make that accessible? And I think technology can play a big role there. Firstly, with Speak, we are very it will always be a hybrid. There'll always be human intervention.
Yeah.
Right? We're not replacing, there'd be not a chatbot would not be the starting point. As much as I'm use ChatGPT for my everyday psychoanalysis of my own brain. But, I think we have a step, we have a journey towards that, especially the area we work in. So we are trying to bring highly specialized interventions to mainstream. Like CBT was the first one to be digitalized because it's very easy to be, it's manual, it's manualized, right? DBT is third wave, which comes from CBT, but it's an advanced form and it's an integrated approach. It includes family work, it includes group work, peer support, everything. And that is what we are focusing on, using humans and technology to make it accessible, affordable, and so that nobody has to wait for specialist care.
So then 2 questions. Who's the target? Is it the moms, the family, or is it the child?
Yeah.
And then what's the mode? So is it an app? Are we looking at?
Yeah. So the first question, I think for me, when it comes to young person's mental health, and that's my personal experience, it is a family issue now. It's not one or the other. Our route is, and that is something we try to do differently, we try to do it systemically. We first start working with the parents. Like it can be a couple of weeks, it can be a week, it can be almost together, but the parent has to be included into. Now, obviously, there's a consent element, and sometimes, and we offer different psychologists for both, and that's fine, but it's also a lot of about learning the same skills, right? Because there's no point that you put the child into therapy and send them back to an environment where they don't get the same kind of response back. And sometimes it's all just about awareness. Parents want to be more than engaged, right? It's just that they are not engaged as part of the process because, again, it'll be an added cost to include one more person. It might not be the same therapy. So our programs constitute of one-to-one therapy work with the child, group work, but also parent coaching alongside as part of the whole program to make sure that it's the whole family that's getting. To your question, we did start with a no-code app, like a scrappy app. At this point, it's largely a service play. We are now onboarding our CTO and our engineering lead to build the tech because we know what we want to build. So that whole integrated. So 3 things, right? Risk monitoring, which is where clinicians spend a lot of time. Engineering the program to personalize it for each family based on a biopsychosocial assessment is the second area where we are so our focus is to build the technology more on the clinician side. The parent and the child side is not easy because engagement is is an issue in mental health, but it's technology-wise, it's not complicated.
Got it.
We could take off-the-shelf solutions there.
Got it.
And mix a stack that works. But our biggest element is building these specialized therapeutic modalities on a clinician-led technology stack.
And technology is beneficial because, ultimately your end user is that younger person.
Yeah.
And the younger person is absorbing every type of information
That's how they like
through
to
technology.
engage.
Exactly. Yeah. So
Simple.
you want to speak their language, obviously. So that's
Exactly.
where you want to.
A psychologist would typically spend in DBT every week 40 minutes reviewing homework for the child. AI can help the psychologist a lot with that, so that their 40 minutes turn down to 15, but doesn't have to be that, but they would still be communicating with the child and bringing the empathy and the therapeutic alliance there. Yeah. And then, you can obviously graduate the clinician.
Got it. Kanu, so, I've spoken to a lot of people on this pod, and not many people have come as close to my pain point or the business that I first started created. So Plum started off as a mental health platform and now expanded into the whole HR space, as we've spoken about. So I can understand the space that you're in. Yeah. I have a personal agenda as well. I went through my own mental health challenges. My mom is a therapist, and I have a huge affinity around the subject. But I've had my challenges from a perspective where, if you look at private, so now we're talking about private care, it is not cheap because, ultimately what we're trying to do is trade that individual or that expert's time for money.
Yep.
And that expert only has 8 hours in a day. So, so it cannot be cheap. So it's not cheap.
Yeah.
The second thing also is the scalability aspect. You spoke about that number. I don't even know it's that low, by the way. It's like you said 700, divide that by 2, 350 population of the country. And then when you flip that slightly, tomorrow you think about scalability, because obviously this is not just a UK issue, this is a worldwide issue, right? When you also look at, sadly, when you look at the number of suicide rates are, drastically going up every single year. There's an increase, and again, sadly, on that, a major part is a younger generation. Yeah. So that stems from addiction or self-harm or whatever that may be. So scalability is a problem as well.
Yep.
So what do you think is a real solution? Cost and scalability. How do we solve this problem?
And I think that is where my bet is on technology to upskill. Technology to be the companion for the clinician, so that you don't have to wait for 10 years to feel that the clinician is ready to be there. There's a whole research in psychiatry that ultimately it is the empathy and the therapeutic alliance between the patient and the clinician that brings about the right change. Yes, it is skill, and we only work with clinical psychologists. We are really high end on clinical scale right now, because until our technology is ready, we're not going to change that. Right? But my bet is that that is where technology can play the biggest role. Right? Now, what gets very difficult is to build these solutions, because ultimately, if I was a pure tech play, which a lot of companies have tried and some have been successful as well, then where do you get the real world evidence and data from to build something like that? And that is why, starting with the more traditional approach, taking it a notch, up every time. And that's why it's a longer journey to a successful healthcare product, digital health product, pure digital health product.
Yeah.
And I think ultimately there would be that world. We just have a journey there to bring that cost. And that's the only element, bring the cost down. Like one of the things, whether it's DBT or any kind of work, like, is group work, right? Alcoholics Anonymous.
Yeah.
A lot of group work.
Yeah.
Now, we are all getting used to digital communities. Voice notes. I mean, Clubhouse was not a success, but there was an element of people getting on it and actually talking, right? So there is a lot that can happen if we actually meticulously, patiently drive towards. And I think one of the things where we went sort of not so correct in, or maybe wrong in mental health, was that we generalized it. There'll be one chatbot and you can start chatting. We didn't focus on the specialization that's needed. Now, when I work in self-harm and I see the parents coming to us, like, ultimately the clinicians would be like, in the end, we are talking about these 6 main themes, right? So you can see patterns when we are specialized. When you're too generalized in something like mental health is not general, it's very personal. And I think that's where we went slightly wrong when we went too broad and said, oh, there's a chatbot that you can chat to and make you feel better, right? It will, if it can actually take you on the journey of what you are experiencing, which I think a lot of good companies, like a lot of companies are now innovating towards. It was great as a first step. I think now it's about bringing specialist care to the forefront.
Something maybe a little bit controversial. So you're looking at AI. When AI, ChatGPT came out 2 years ago, almost, or just over 2 years ago, and it was like, oh my God, this is the devil, and it's going to take away our jobs, and this is crap, and whatever. Today, we hardly Google, we do everything on ChatGPT. So the world has changed. And I think what really happens is when there's something new, human beings just have this wall up in front because people do not like change. I think that is a problem. But what is controversial, I think, and could be controversial. I mean, I'm in the space, so I'm also trying to understand. I'm trying to prick your brain on that. When you speak to people, and this is my first-hand experience, when I speak to people, no, it should be a human being because when it comes to mental health, it's only a human being.
Yep.
Okay, but the problem is that human being is expensive, but I don't have the money.
Yeah.
So now make it cheaper. And then scalability is a problem. So I have seen that there's also maybe a resistance to accepting technology come into play.
Fully agreed.
But then you also you have the affordability and the scalability issue. So how do you want us to solve the problem? This is one. The second thing is also, from the flip side, is speaking to therapists. When you look at the results, again, I'm no therapist, but when you just look at the results data sets, the results from an AI or technology is also giving you really good results.
Yeah.
So now the problem is here, what are we saying? So therapists, so what space will the therapist then hold if the AI is then taking care of, because scalability is a problem, affordability is a problem. So this means bulk of the issues are going to go to an AI or technology, and then a small portion comes to human beings. Is that where we're going? And then how does that impact those experts or those therapists? So yeah, I don't know. Maybe it's a little bit. It's just because this is what I've been dealing with since the last couple of years. So it's a catch-22 situation. We know technology is the solution because how else? Like I don't know how to. There are 8 billion people on this planet today. All of us, if not most of us, if not all of us, have anxiety, stress, this, that, whatever. I think we all should go into therapy. I think things have drastically changed. But then you look at all these different layers and you talk about self-harm and so many critical aspects, but you just don't have enough human beings to service those problems. So the dilemma is, okay, the acceptance of technology. I think there's still a resistance around it.
Yeah.
But if you don't accept it now, things are just going to get shittier and shittier as we progress because people are sadly dying.
So I think your first point, yes, there's a resistance towards acceptance of technology, right? And I believe you don't have to change. The front end is not the first thing to change, right? It's the back end. Like get your data set right? Get your technology right so that it actually gets the same kind of outcome that a clinician would, right? And then, even then, you might not have to remove the human being, right? So in psychology, there's a whole variation from a clinical psychologist to a therapist to a counselor, right? And that is where you graduate. So when we talk about Ginger, the US company that is one of the success stories, that's what they did. And the clinical outcomes still might not be impacted. I think none of their clinical outcomes were impacted, right? Because you then support it in the right way. You provide that. And then for the user, it's still the human being, right? So it's the empathy, it's the therapeutic alliance, it's that. So that is one way, and again, to be worked out. The other element to your point with regards to AI showing similar results. Now, in psychology as well, the needs are varied, right? So there's a need of sometimes we are like, yeah, the child is self-harming, but a couple of sessions is good enough, right? And that's low intensity support, right? And there'll be personalization. Some people love to chat. They don't want to be on the phone. Some people want to speak to somebody. And that is where I think, and I'm not worried about therapists because therapists are too, they're too less in that sense. So, this is the market for the good therapists. So I think from that perspective, from a workforce perspective, there's not to worry. And I think we have a long way to go. I think graduating clinicians to where they are needed is the point. At this point, you're making them do anything and everything.
Correct.
Right? And that is where we need them, we're not there. Right?
Yeah.
So there's a lot of stopgap solutions that we are providing, which aren't and stopgap solutions, I'm saying stopgap, maybe that's not the right word, but low intensity solutions are great for, on the day that I'm not feeling good, right? But the day I'm actually self-harming or suicidal, I need to be speaking to a professional, right? And that is where I think that it's the hybrid, it's how you use technology. It's, I think, a mix of art and science, of blending that together to build a robust model that would then, and then there'll be a lot of operational excellence here. Process innovation, even assessments, right? So yes, everything can be how in the beginning there was so much resistance that, you cannot diagnose or assess without human beings. Now look at all the companies doing it. And it's hybrid still, right? Ultimately, a human being will do they need to sit with you 3 hours? No, maybe 30 minutes is enough because a lot has been processed by the AI and they'll focus on the things and the AI can actually tell them what are the areas they need to go deeper into. What that means is your skill of the clinician can also graduate, right? You don't need the 15 years experience person, and you can find that balance for the bulk of the cases. And then we'll always have specialist services, right? So it's the severity, I think it's redesigning healthcare in a way that it works for a human being, where you are in the journey. It should meet, the solution should meet people where they are in a format that works for them. And that in a format that works for them is also quite broad, because with generations, I don't see my 7-year-old nephew wanting to sit in a therapy room.
Yeah.
He wants something different. He wants an avatar, or he wants to VR. And and that's where we need to, I think what is happening is a point solution, and that's how it starts, because, building a whole ecosystem of if there's a neo clinic, right? Like neobanks, we have a journey to that, but that's where we would be. I think, what is that company, the one that raised the Apple, the Spotify guy, Nico? Yeah. So look at them now.
Correct.
So we're getting there.
Correct.
Right? It'll be some time where, I have a lot of hope that technology and human mix is, it's scalable, it's accessible, faster, cheaper, better. If you're faster, cheaper, better from where you are today, that's already progress.
Correct. And I think that's human evolution in general. If you look at the agricultural revolution to the industrial revolution, technological revolution, today the AI revolution, that's exactly what we've done.
Yeah.
Faster, cheaper, better.
I think where we went wrong was that Uber launched and then there was Uber for doctors.
Yeah.
Right? The boss is neither doctor knows, I think we went a bit crazy running after the whole, SaaS world to say we can deal with healthcare like this. I think fintech had its own journey. It's a highly regulated. I use fintech more as an analogy when it comes to healthcare because it was a highly regulated space for different reasons.
And it broke the mold.
Yeah. And here you're dealing with human life. You can't go fast in that way. Yeah. If you don't have the patience, that's why I think healthcare is not for everybody. It is not for everyone. It is,
I know.
I'm preaching to the board.
I know what you're talking about.
Yeah.
That's why we've also moved into a hybrid approach. Now we've moved into HR tech simply because, and I completely resonate and agree with you. So that's exactly what we've done as well. So we started, AI is like your entry level. So meeting the person where they're at, but also from a time perspective, when the fastest we could connect an individual to a therapist was 24 hours. But if my problem is now pressing today, it was better than Googling something.
Yeah.
You have an AI. AI can then do a triage and then connect you with a therapist. So that's where we're at. And interestingly, the data that we have, so we only cater to adults. So there's not, above 18. So obviously it's slightly different demographics to yours. But interestingly for us, we saw men using our AI so much more than women, because it was just an easier mode for them to open up.
Yeah.
There wasn't a human being, non-judgmental. They could just chat.
Yeah.
It was just easy. It was just within them. And then we also saw how it translated into uptake to therapy sessions.
There you go.
Men who've never got into therapy were now in a space where, okay, I could
Yeah.
try one session
Yeah.
and let me see how that works. Because now they've been, having a conversation with their AI since the last couple of weeks.
Yeah.
And they just felt there is something good about this.
See, that is the thing. I think replacing the clinician is not technology's job, and that's not what, I think we went a bit too ambitious maybe on day one. But the approach that you're saying is exactly where tech comes. And there are so many young people who are not open to therapy. So this kind of an approach brilliantly works.
Correct.
Where they can have peer support, they can chat, they can get warmed up to it. Maybe have communities where they're listening to other young people talking about how they're recovering. And then Alcoholics Anonymous, I have my opinions about it, but it did work in some ways,
Sure.
right? Because there was that community. So, and now communities are digital. So technology has its place. I do not believe in technology to replace. We don't have clinicians. Who are you replacing?
Yeah, no,
Right.
correct. It's a good point, actually. Good point.
Clinicians are sure, be my guest.
Yeah, no, good point.
Right.
So you said your ICP or your customer is the parent.
Yeah.
Are you also looking at like a B2B play? Is there corporates or is there schools? With
schools, we partner. There are more of a marketing channel,
Okay.
like partner channel where we build awareness, education.
And they introduce you to the parents. That's the...
Yeah.
So like a channel partner in a way.
Yeah, it's a channel partner.
Okay.
Yeah, actually, yes. And the other thing we're doing, we have a pilot with NHS in Midlands
Okay.
that we are working with. That happened last year, hoping to renew it this year. So renewing it this year. So that is one we are trying to integrate into other. And as you know, NHS, I'm almost depending on the day. One of the days I might say no NHS, right? But depending on today, I'm we are trying
That's a different beast
It
all
is
in
just
itself.
that, as much as I'd like to say no NHS, when 90% of your market's population
Yes.
is dependent, and I want to build a solution. I always say when people have £400 an hour to pay, they have solutions.
Correct.
They can find a psychiatrist.
Correct.
It's the ones that do not
Who
have.
do not have, yes.
Right.
Absolutely.
So I do not have the motivation, and I'm not saying people don't need it. I think everybody deserves the best solution, and I think our proposition actually works very well for even the affluent because it's gold standard care, right? Which is not you can go to some clinics and get one, young people hate going to stuffy clinics. Secondly, you can. It is about the approach as well. But having said that, I think the bigger problem is the ones who just don't have access to quality care, right? Specialist care. So NHS, yes, but I'm literally now researching to see the UK insurance market.
Okay.
It's a growing market. It's small, 12% of the population. Within that, you're talking about households, and then you're talking about family insurance, which would be a much smaller market. But Aviva published a report last year that I think they've seen a huge increase in claims for young people, anxiety and self-harm.
Oh, wow.
Right. And those are the two areas we kind of anxiety and self-harm are quite related as well. So then I was okay, if their claims are going up, then, maybe that's a conversation to be had, because that is where we bring a cost reduction so that they can provide service to a lot more of their clients. So kind of thinking through those partners and channels in that approach. But we are nowhere near cracking any one of the channels. Yeah. Private for me, B2C, unfortunately, will not work. Because
Is it because of the affordability aspect? Or, okay.
even though we are 50% cheaper
Sure.
than the specialist solution available today in the private market.
Sure.
Even then,
Yeah.
right? I think it kind of goes back to that stat. We are talking about £2,700 monthly disposable income for an average household. And a solution that costs £700.
Yeah.
It's just
Yeah, same thing happened with us. We started as a B2C play and then immediately understood, oh my God, this is a very expensive service.
Yeah.
No matter how cheap you try and make it.
Even if it's 50% cheaper, it is super expensive.
Because we were also more affordable. We were more affordable because we also somehow did pricing arbitrage because we had therapists in the UK, but across the globe as well.
Yeah.
So you could connect with the therapist in South Africa, for example,
Yeah.
and so on. So we did that pricing arbitrage, and that meant the cost was low or lower compared to solutions that you would get here. By all means, if people wanted to connect with a therapist in the UK, they could. But then we're playing on a volume game as well. But still, it was very expensive.
No, but the young people, we can't
It's
do that. We
just-
focus on like UK-based clinicians, which means that the cost.
You also cannot do that. Yes,
Yeah,
exactly.
yeah,
You
and
cannot.
it's the data access and everything. By the way, on your tech point, tech is a big role in prevention.
Correct.
Peer support, access to psychoeducation
Correct.
in a format that works for people.
Correct.
A lot of it is psychoeducation, of being aware on how to regulate your emotions, how to understand. So, tech has a big role to actually reducing this in a very different way, right?
And I think, healthcare in general, especially the mental health space, up until now, again, my experience, I don't know how you feel, but up until now, mental health has been looked at as a reactive measure than a proactive measure. So from an adult perspective, okay, when I'm burnt out, I will go into therapy. So it's like, okay, when I get a stroke or a heart attack, I will start eating salad and run on a treadmill. That doesn't make sense. It doesn't make sense from a physical aspect, but somehow it makes sense from a mental health aspect, because that's how, I think it's lack of
Because
awareness.
There is
and
no six-pack abs for mental health.
This is the issue, because you cannot see it.
Aspiration and motivation, right?
Correct. You cannot see it.
And like we were
that's the
talking
problem.
about the laziness of the product.
Yep.
Like, I mean, like I'm not recommending it. What I'm saying is it's in the human nature to grab a piece of chocolate or, a couple of pints, versus it goes against the human nature. Right, wrong is
more
the
effort.
rational part, right? It's more, especially when you're feeling bummed. Like, imagine the day you're not feeling like it. That's the day it takes the most, right? And then it's been days and, the stressful life of being a parent with everything else going on. Like, what do you do? Yeah. And we are asking people to be a lot, right? And when services are not accessible, it's expensive. Where do you go?
Yeah. Yeah.
So I think there's no six-pack abs for mental health. I think somebody said that to me. It's not my quote.
I'm going to take that, by the way.
Yeah. Which is the reality of mental health.
No,
right?
that's so true.
Yeah.
So what has Speak done so far in terms of your business, where you're at? You've raised money. What, if you can just talk me through that?
So we've serviced roughly around over 350 families on our parent intervention.
Oh,
Where
amazing.
we support parents, largely B2C, 150 through NHS, right? So it's a good mix. We've now launched our family inclusive program, which is the gold standard of self-harm recovery. It is accessible, affordable, so I think I really, really hope, we get a lot of families using it so that we can show the outcomes. We've raised a pre-seed round. We are good 12 months, 18 months away from talking about money, not raising more money. And I think our focus right now is two things. Building our program into what works for young people, like they engage and they actually go through the whole program, and proving evidence through clinical trials and stuff. So we've got a couple of NIHR grants and Innovate UK grants to prove that evidence. So that's the two focus, and finding the channel. So, everything.
What's the aspiration 5 years from now?
That every family where there's a need of a psychological support has access to it on the day they need it. Like, I just think specialist care should not be something hidden in the, there's too many loops. Like today, people are waiting for 2 years for specialist care. Come on.
That's ridiculous.
That's ridiculous. Yeah. And we know that works. So the funny thing is we know it works.
Yeah.
But we're not giving that. It's like, we'll take you around and see if, somehow something gets, we're hoping
You
against
just drop off.
Yeah, some miracle will happen.
Yeah, you just get well.
Right. You just get well. And we don't, like you said, we don't treat physical health like that. Right? If somebody has a cardiac arrest, you don't tell them that, let's see, maybe in a year, let's figure out if you survive. And so I think for me, the hope is that every family that needs access to specialist care should have it on the day. Yeah.
The decisions that we make in our life, has a very strong correlation to where it leads us. So you've made obviously a lot of decisions. One of them was to start this company and move to the UK. What would you tell yourself before you made this decision?
I wish I was that reflective and that,
Now is your chance. You can take a moment.
What would I tell myself? That it's nothing you've imagined, the journey. But I always say this, I wouldn't change a bit. Like, it has, So I think I'm thoroughly enjoying. I think I'm at a very different level of passion that I've kind of missed when I was in corporate life or anything. Like, it is just where I always desired to be in terms of my passion. But boy, is the journey, a roller coaster. Yes. And what I really enjoy about this is that a lot of this is internal work. Like, I would have not called myself with a deep fear of rejection person. And now I realize, oh boy, like I have, so those like that internal, like, and nothing else. Like every day I tell myself that I'm only as far away from what I want to be as much as like, it's my effort. It's all about my effort and the power of that, right?
Mm-hmm.
So like our first NHS contract was, people asked me, how did you get it? And it was a paid contract, 45K and LinkedIn outreach. I reached out to every commissioner in the UK.
Wow.
I sat one night and I was like LinkedIn. And who would say that NHS would give, I like have no idea of like who they are, what went into the meeting, 3 meetings, nailed it. And like, again, it's a small contract, not making claims. It's not, it's not big claims to be made here, but that is, so for me, that the pain and the joy of it is, what I wouldn't do it any other way. I'm thoroughly enjoying it day in and out. Yeah. And I made peace that, it might not be like 5 years later, solution might look different. I just hope that I solve the problem.
Yeah.
My passion and my love for the problem in the sense of solving the problem is, I really hope I can create an impact there.
Your reflection actually allowed me to do a little bit of reflection as well. What you said, it's a lot of internal work. It is a lot of internal work. I think this entire journey, if I were to summarize it, wow, talk about personal growth. Forget the growth of the company and everything that you've learned, whatever, but personal growth internally, not from a learning perspective, but it's just like, wow, just understanding who you are.
And that there's such a distance. Like you think that you made
Oh my God, no. Like,
No.
But also I think it's very, that personal work aspect, I've also come to a realization that I've made peace with the fact that I do not know.
Yeah.
I do not know.
And that I don't need to know.
And I don't need to know. And I'm okay with that.
Yeah.
And I'm okay with that. And every single day, okay, it's a learning curve. How can I fail? What can I learn from that?
Yeah.
How can I grow?
Yeah.
That's it, And I think, when you look at success or you look at building companies, whatever, when you first move into it, everything looks like rocket science. It's like, oh my God, like these people are so smart. They're so educated. They know this, they know that. They've been in the system. Or especially with immigrants, like you're coming to a new country, you're like, oh my God, like what the hell?
Yeah.
But really, everything is so simple also.
Yeah.
Like if you just break things down, it's like, it's just mindset, just do it. Just keep doing it. That's it. Just keep doing it.
Entrepreneurship and immigration has such a deep connection because it's like when you immigrate, you basically build your life again.
That's so true. That's
like
so true.
it's you build from friends to social connection,
That's
to
so
human
true.
connection, everything, right? And that is like I think if you do that, and I think that is where for me, the scary part is not the outcome of it,
Yeah.
or like but it's it's. By the way, I've not made peace about the immigrant and the immigrant. Can you tell me what does an immigrant mean?
I have no idea what the difference is as well. Maybe I should have looked that up because I know us talking about that on the virtual call.
And I just realized that I spoke to you
So when I was in Dubai, we all called ourselves an expat.
Yeah.
An expat is because
out of choice. In my mind, it's like out of choice.
No, also, again, I don't know if people are going to quote us on this now, but whatever, maybe we can add comments under the video. But that is because, so an immigrant is because you've moved, like, you're not just relocating, you're moving and you're going to be embedded in the system society, i.e. you're going to then tomorrow become, so nationalization. So you're going to become British tomorrow.
Okay.
But for example, I was an expat in Dubai, in the UAE, because they don't have that system there.
Okay.
So I'm always renewing my visa and I'm always an Indian by passport and nationality.
Yeah.
But here I have the opportunity to integrate. And that is why I'm an immigrant. That's why I'm
immigration.
Yes, immigration. Okay. An expat, then you don't have that.
You don't have the option or you don't want to?
No, you don't have the option. It could be you don't want to also. I'm not too sure now.
Because expats go and they come back to their country.
Yes. It could be that. It could be that as well. So, and maybe you asked me this question because in Singapore, is there nationalization? Like you can?
It's very tough. It's not as standardized and as straightforward as UK. But yes, there's
But you can if you wanted to.
It's not like Dubai where you just can't.
Okay, fine. Okay. So I think that's why the Middle East, for example, I don't know if
Yeah.
it's all, but at least Dubai, you'd be an expat.
Yeah.
And here, now I'm an immigrant because
Yeah,
I've
yeah,
got my ILR, I'll be applying for my citizenship and so
Yeah.
on. So I think that's the difference.
For me, it was more
But-
like I don't want to take away from the hardships of the people who actually go through the whole immigration process. Because for me, I'm like, I'm like, it was a very choice-led thing. Or let's go and live in London now, right? And yes, the visa was a process and everything. But I don't want to say, oh, I also had a very difficult immigrant life. No, I did not.
Yeah, no, of course. I mean, it's interesting. I was actually speaking to someone again on the pod, and I was talking about my reality, like, everything's been amazing, and people have been so nice to me, and so all those aspects. And then what he told me was, he's like, yeah, but you also came into the country as a founder, CEO, and
It's a luxury. It's a place of privilege already.
Things were different.
I didn't get off a boat and said, oh, I'm going and pitching my idea.
Correct. So I was also like, that was a reflection point for me as well. I'm like, okay, yeah, that's true. And he's like, that's why, you get a different level of respect and all that. I'm like, okay, so yeah, my reality
It's a
is
privilege
different.
thing, right?
Correct. So
Yeah.
to be honest with you, up until then, I didn't realize, and it's good, that's why you speak to people. The more people you speak
Yeah.
to, the more your
Yeah.
eyes and ears open. And I'm like, okay, that's fair. However, the reason also, I keep talking about that is there is a lot of negative connotation around the word immigrants, whatever.
In what sense?
Just in general, like, immigrants come to our country, they take our jobs, and it impacts the economy in a
Have you
negative
looked at
manner.
it too many
this, that,
times to get
whatever.
impacted?
So I mean, if you think about that, it's also about flipping the script
Yeah.
on that perspective as well. But then there are a lot more people who now come in and give back to the society and
Yeah.
economy and whatever. So actually, immigration is what helps economies. I mean, we
human
also
nature,
spoke about
yeah.
how beautiful this city is, London, because it's a melting pot.
Yeah.
And if you look at Dubai, and if you look at New York, if you look at all great economies,
Yeah.
are off the back of immigration. It's like people coming together from different cultures and just creating something magical. I think that's just beautiful.
When we closed our fundraise, one of our investors had made a post or something, like, underrepresented founder or something, right? Which, as a
Okay.
woman, right?
Okay.
My brother saw it, showed my mom, and my mom actually got upset at it. She was like, you know what? We sent you to LSE to study. You don't sit and bullshit and give a sob story for fundraising. And I was like, I am not giving any story, mama.
You're privileged, woman. You're privileged.
The thing is that, I mean, you might know that because in India, they have a lot of pride attached to,
Yes.
Right? So
also, also it's very interesting. Again, we're just digressing now,
Yeah.
but it's a conversation. It's also very interesting. When I started speaking to people, I also started speaking to people from third world or developing countries, like let's say India and South Africa. What I also realized, again, I've yet to speak to some other people, but I also realized that, mostly it's the privileged people who are now sitting in the seat. When they come from developing countries, like, if you're not privileged in that developing country, how do you land up in the UK?
Exactly.
Like, it's... You
and for me,
can't,
that
you
is
know?
why I want to always remove myself and not take the credit of the adversity in that sense that, yes, it's been women are generally underrepresented when it comes to fundraising and so those buckets. But I think there are some people who genuinely refuse, when you, and I've had friends, I have a friend who actually lived in the refugee camp. I'm like, I should not be saying that I'm her. I'm not her in the sense of she's really gone through stuff that would have made her life 100x harder in that sense. And it's only fair that she gets, to tell her story in that way. And I think for me, that is a just important deviation. Also, like I said, the family privilege, it's not like we don't have economic issues in the UK, right? So some people, some of my friends that I know they've lived on free meals, right? And why should I make it sound like my life is harder just because they're white? That's she's had her share of. So in that sense, who's the privilege? Where's does the privilege?
No.
So I think that is where for me, D&I is about a lot beyond, and I think that's how it is sort of to be. But you also said something which kind of resonated deeply with me. I think I was not minority in India. I'm not in the sense, and that for me is important because the people who've actually gone through hardships, so that's why my mom's comment of don't you give a sob story? I was like, no, I'm not. Exactly. But women are underrepresented.
No, of course. And one thing doesn't take from the other,
Exactly.
I mean, the premise of this dialogue really is about, there are immigrants also.
Yes.
Because that is also a fact. That title is a fact. You are an immigrant in this country. So there are immigrants who are also building companies.
Yes.
So because of a lot of negative connotation, it doesn't come easy. But also, I think it's also important to highlight that if we are building companies and impacting the economy, positive manner, this, that, whatever, the taxes that you pay off the back of the company and the jobs you create, whatever, it's great. Like I just want to, my stance is from a place of being grateful.
Yes.
This country is amazing. It's changed my life. And it's allowing me to do the things that I do. Every single morning I wake up, I feel ever so grateful. Like today, you and I were walking to the office and we're like, oh my God, it's cold and the sun is out and it's just beautiful. So from every aspect, it's just changed my life like everything is just positive for me. And just to highlight the fact that, wow, this country is great, not only limited to immigrants, obviously, but for the people who are here, if you and I can do it, everyone can do it.
Yeah, and people make, a place. Really, like for me, that has been the biggest theme of every time I relocate, and I think I just love it's so inclusive. Like I just can't get over that fact.
I love it.
Like in fact, I think I've been now 3 years here. I've the number of people that have supported me through this journey, and none of them are it's not like because they're Indian or because they're
no,
right?
It's also interesting how people easily see beyond the way you look, what you're wearing. Nobody cares.
Nobody cares. Yeah. My accent is not British accent. It's very obvious.
Doesn't
matter.
Right?
And that's totally fine.
Doesn't matter.
So I think that for me is way more powerful than anything else. And that makes the city beautiful in its own way.
100%. Yeah. Well, Kanu, it was a pleasure talking to you. You're doing amazing things. I hope all the aspirations that you have in the next 5 years come true and then some.
Yes.
And we should keep on working towards mental health. I think we are sitting on an epidemic and we need more people like you.
We do have a sales
to make
problem,
a change. Maybe we can chat after the pod.
Yes. Thank you. It was a privilege. And I really enjoyed the conversation. I felt like I was just talking.
Thank you.
And in the sense of having the conversation, but no pressure of the podcast.
Thank you.
Thank you.